we expecting Santa?
No.
Okay, okay, thanks for the update. Okay, is the tape rolling?
Yes.
Awesome. I'd like to call this Board of Health monthly meeting to order. Okay, for Wednesday, September 11th, 2024, at 5 p.m. Can we call the roll, please?
Danielle Chenoweth,
Present.
Samantha Carter, Kyle Patterson.
Here.
So next, we have approval of the agenda. I'd entertain a motion.
So moved.
Second, any discussion? All those in favor say aye.
Aye.
Opposed? That carries. Next, we have approval of minutes of previous meetings, August 14th, 2024. Any comments or questions?
So moved.
We have a motion, I'll second it. All those in favor say aye.
Aye.
Opposed? That carries. Next, we have public participation. Is there anyone here to speak to the Board of Health? From the public? Okay. If not, we'll move on to correspondence. Julie?
Oh, yes, there is something. Yes,
Flu and COVID vaccine?
yes, thank you. So what happened is we have, we need to purchase a lot of flu and COVID vaccines. So I went ahead and approved it and sent it through, so we're gonna have to get those bills due next month
Okay.
for ratification. When we're allowed to order, we can order, otherwise we can't, so we jumped on it.
Yeah, no, that's a really
Thank
good
you,
idea.
Brandon.
We need flu and COVID vaccines, please, and thank you.
Yep.
This summer was really rough,
Yeah.
Yeah.
more rough than our office has seen before. This
Yeah.
was the worst, actually.
It was crazy.
Yeah. Yep,
Okay.
so we're hoping everything's in within a couple of weeks.
Okay.
Okay.
Okay, sorry. Anything else, correspondence, board members, Julie? Let's be done with the pandemic. Next, we have no business, we'll go into.
Wait, that reminds me to mention something,
what?
that we should have done with the pandemic. You should be alerted at least that a case in Missouri is in a human who was hospitalized with the bird flu, who has no contact whatsoever that they can determine with any animals. That means that, or anyone that had it, that means that they got it from somebody who didn't know they had it, so.
And that's the closest that's the closest we've had, nothing in
Yeah,
Illinois.
it's the only case that's not been associated with animals.
Okay. Oh, the only
That's
case in the
concern.
United States.
Mhm.
And is there,
That means it's spreading somehow without anybody knowing it, but they're only testing, what are they testing now? They're only testing if people are hospitalized?
Yeah, if it's unsympathable and they're hospitalized, then they're submitting it to the ICU staff. Right?
Which
It's
is-
just a sign that there are undetected cases.
Which is a sign that we're not doing what we need to be doing as a country because we didn't learn our lessons,
is there?
basically, so, okay, that's it. A little cheering up for everyone.
Is it airborne or surface or both?
Well, they
Or
spread
is
like
it-
regular flu, so
or
it could be
contact?
droplet, they think, but it's a new one, but this one, they're getting it from milk, which is something that we've never seen before, so.
They're getting it from milk.
They can get it from milk if it, like animals are getting it from milk, from the cows, because it's in cows.
Oh.
So it's bird flu, but in the US right now, it's mostly in cattle, where
Okay.
the human-animal interaction is happening, but they're finding it in all kinds of stuff. But they're only testing people, so there are 14 known cases in the US right now. All of them, except for that one in Missouri, have an association with the cattle thing. That also tells you that they're only testing people who have access interactions with cattle and are sick, so.
Okay.
That might pop up like a little mushroom right as I'm leaving. Kitty.
Do you have any news for us about that?
No.
Okay. Thank you, Julie. Next, we'll have the treasurer's report from Ron Fields.
Yeah, the financial report as of July 31st, 2024, showing cash on hand at $7,364,110. Our total fund balance is at $7,445,063. That represents represents 44% of the, I guess we're calling it anticipated budget for the year. The first month of the fiscal year showed a deficit of $150,539 against a budgeted year-to-date deficit of $126,978. And then the total annual estimated budget would be $16,958,747. So our total revenue for the first month was $1,080,080, which is $259,105 under year-to-date budget. Property taxes under year-to-date budget by $51,847. Contracts and grants and contracts under year-to-date budget by $125,332. Fee for service under budget by $76,753. And other revenue under year-to-date budget by $5,172. Our total expenditures were $1,230,618, which is $235,541 under year-to-date budget. Mostly due to personnel at $118,637 under budget. Fringe benefits under budget by $44,018. Contractual expenditures are just over year-to-date budget by $47,908. Supplies under year-to-date budget by $24,254, and capital outlay under budget by $96,584.
Great, thank you. Any questions? I have a question, which is, where is the about $300,000 loss for the duplicate check represented in this? Is it?
Last year.
It's last fiscal year, so this is starting July 1? Okay. And I forgot to mention in correspondence that I would like to get an update on the status of our insurance claim around that and the investigation through our kind of like, I know we talked right away about what we were putting in place in terms of security, but I'd like to understand our ability to recoup that. And I'm happy if it is appropriate, and I think this is a Ruth question, it may be appropriate for a closed session meeting, Ruth, for us to talk about the fraud that we experienced as public health, the loss of over $300,000, and our attempts to recoup that fraud through our insurance. We haven't had an update on that, so I don't know. My question is whether that should be a closed session or open session. And you can answer it by the end of this meeting, because obviously we're not gonna have that.
Yeah, I will do that, or what we can do is put it on the agenda either as a, and I'll look that up, and so we can discuss it, if it can be discussed in closed meeting. I just need to research that issue. Is that something that it should be done in closed session, or it needs to be done in open
Okay.
session?
Yeah, we have some time to figure it out for the agenda.
Okay.
Any other questions for? No? Okay. Next, let's see. We have approval of payments to Board of Health appointees, Treasurer Ron Fields for August 2024 services, and to Attorney Ruth Wyman for legal services from July 16th of this year to August 15th of this year. To entertain a motion.
So moved.
With a motion, I will second that. And the totals were $700.20 for Ron Fields and I believe this is $800. Oh, $525, thank you. We have a motion, a second, any discussion? All those in favor say aye.
Aye.
Opposed, that carries. Next, we have a review of monthly credit card statements. Do you have any concerns or questions about the credit card statements? Nope, okay. No concerns. I didn't have any questions. Next, we have approval of the CUPHD 2025 tax levy, the determination of the amount of money to be raised by taxation payable in calendar year 2025, and approval of truth in taxation resolution 2024 for September 1st. I'll take it in omnibus fashion.
So moved.
The motion, I will second that. I think we're just putting, did we put this on file and now this is approval? I'm trying to remember, or do we, with the, I think we have to do the truth of taxation resolution, and so we're putting it on file today, and then we will approve it next, our levy at the next meeting, is that correct?
The ordinance gets voted tonight, the next meeting. I'm not sure, I thought the resolution was this time.
Did we have? I'm pretty sure truth in taxation requires that we have to, it's even in the document of the ordinance. Ruth, do you recall, I think that we're, yeah, so so we're not passing it. The notice of the proposed levy and the planned public hearing shall be published in the News Gazette between September 25th and October 2nd.
Right.
So
But you would pass the resolution today to put it in there.
yeah, so the only action for today is approval of the truth in taxation resolution, correct?
Yes.
Okay.
And was that what had the change in it?
No, it's the notice, there would, I just suggested the change.
Okay. So what is before us is approval of truth in taxation resolution. 2024-09-01. And you moved and I seconded. Okay. All those in favor say aye.
Aye.
Opposed? That carries. Next, we have approval of an MOU between CUPHD and Douglas County Health Department for fiscal year 25 Illinois Tobacco-Free Communities Grant. I would entertain a motion.
So moved.
Second, any discussion? All those in favor say aye.
Aye.
Opposed, that carries. Next,
I don't know if this is something, and this doesn't have to be voted on, but there was in the notice of proposed property tax increase that gets published, there was a time at 4:30, and so for the next month when you guys are when the board meets, I didn't know if you wanted to leave it at 4:30, which is when the board used to meet, or because there's usually not too much business, if you want to move that to 5 o'clock.
yeah, we should move it to 5 o'clock because that's when our meetings are. So could we actually, so we should probably go back and amend the,
Well, it's just a notice, so it's not the, it's not part of the resolution, it's on the,
I see it as the resolution, it's listed on page 2 of the resolution number 4.
that a public hearing.
Mhm.
Oh, you're right, I'm sorry,
Yeah.
it is on there, yes.
Yeah, I mean, I think that we should stick to our 5 o'clock plan.
Yeah,
So-
so if you just want to amend by delineation
Yeah.
the resolution of the time on paragraph 4.
Yeah, I want to move to amend approval of truth in taxation resolution for 2024-09-01 to change the time of our meeting on October 9th, which will be the public hearing from 4:30 as written to 5 p.m.
And so as long as that's accepted as a friendly amendment.
Would that be accepted as a friendly amendment?
Yes.
Just be friendly about it. Okay. So, let's go ahead and take a vote on the amended motion. All those in favor, say aye.
Aye.
Opposed, that carries, and that supersedes our motion from before. Next, we have approval of check request payable to Illinois State Board of Education for the return of unused grant funds. Entertain a motion, second, so we have a motion and a second. Any discussion? Can we just briefly, what the service was that we're returning funds for?
Brandon, is that you, the Board of Education one?
Is that great start?
Yeah, it's for the Great Start Prevention Initiative Program.
Not enough clients,
Yeah.
correct? You can-
We had some staffing changes, had 3 staff leave within 6 months, and we were hiring, and so we had salaries and things like that. We also started the doula program and had to wait a few months to hire that staff, so just with salaries and things, we had some unused funds.
What was the total, approximately the total amount of funds? This is 30,000 or so that we're returning.
It said 30,000?
It says that we're returning $30,325. Does that sound correct?
No, mine was, I think it was 120,000, isn't it? Yeah, it was more than 30,000. So was that our program?
I'm looking at Illinois State Board of Education, it's a letter dated August 14th. and it says that for the early childhood block grant, which I guess answers my question, I see it now, that the refund amount due is $30,325 and no pennies, and that they must be returned within 45 calendar days.
Was there funds returned last fiscal year?
There were
Or the end?
funds, there was another return
Maybe it
of
was-
funds that I believe was similar to early childhood, if I recall.
Okay,
So maybe
maybe it
this
was
is just a
split.
portion.
Yeah, it might have been split.
Last month, the money returned to board.
I think the total for fiscal year 24 that was gonna be returned was around 125,000.
Okay.
Out of 800 or so, right?
What's that?
Your total's about 800,000?
Yeah, the total grant is 860,000. But I think 125 is gonna be returned. So maybe it was a split.
Okay. That does, I mean, I know that I asked a similar question around a grant, and it was about 100 some odd.
Oh, maybe that was the one.
Yeah, it was like close to 100,000, so if you were thinking it'd be 150. I could check, because I have other packet. Okay, all those in favor say aye.
Aye.
Opposed? That carries. I just want to point out that I think it has to be returned within 45 calendar days at the end of the grant agreement, but they also only sent it on August 14th, so.
They don't care about when they send it.
Okay. Next, we have approval of check request payable to Tyler Technologies for consultation and project management.
So moved.
Second, can we get some background on this piece?
This is the training to build out that computer system, the new electronic inspection program.
Okay.
Restaurant inspection.
Oh, restaurant inspection, got it, thank you. All those in favor say aye. Aye. Opposed, that carries. Next, we have approval of plan review specialist job description.
So moved.
Second, can we just get a brief summary of this one?
I think
We are deferring that.
Oh, that's right, I'm sorry, you asked me to defer it.
Yes.
It's a long day. I move to defer, forget the motion second, I move to defer approval of plan review specialist job description.
Second.
Moved in second, and I guess I would say deferred until it's ready, like we won't table it to a specific date. All those in favor say aye.
Aye.
Opposed, deferred probably doesn't take a vote, but just in case. And then pending grant contracts for the administrator to sign.
and there's one,
What's that?
there's one, should be your last page on the whole
Okay.
packet.
Oh, there's only one.
Yeah, there it is.
Oh, okay. Thank you. We have between CUPHD and IDPH an LHD respiratory surveillance and outbreak response grant to continue surveillance and outbreak response efforts for respiratory diseases and other public health significant events. It's a grant in the amount of $517,304.45 for the administrative division for a contract period of this year, fiscal year and next fiscal year, July 1, 2025 to June 30th, 2026.
24.
Oh, I'm sorry, June, thank you, July, I'm glad you're with me. July 1st, 2024 to June 30th, 2026. I would entertain a motion.
So moved.
Second, all those in favor say aye.
Aye.
Opposed, that carries. And with no further business before us, our next monthly meeting will be October 9th at 5 o'clock, and that will be the public hearing for the levy. We stand adjourned. Thank you. Adjourned.
That extra half hour is also fine.